Hello and welcome to Health Matters, coming to you on Channels Television. I am Mary Alale Yusuf. More than 5% of the world's population are carriers of the sickle cell or thalassemia gene. In Nigeria alone, about 150,000 babies are born with the sickle cell disorder every year, many of whom die in childhood from complications of the disease. This represents the heaviest sickle cell burden in the world. There is proof, however, that this burden can be significantly reduced, sometimes with simple and inexpensive but early intervention. On the show with me today is the head of clinical services, Sickle Cell Foundation Nigeria, Dr. Ajibola Sanda. You're welcome to the show, Dr. Sanda.
Thank you very much. Good morning.
I'm sure your ears are almost off with hearing this thing, but do explain to us how somebody gets the sickle cell disorder.
Okay. First of all, sickle cell disease or sickle cell disorder, as it is called nowadays, is an inherited blood disorder that affects the red blood cell in the human blood. What happens is the person possesses an abnormal hemoglobin, which is the hemoglobin S. And
hemoglobin and blood, aren't they the same thing?
No. Hemoglobin is a protein in the red blood cell that carries oxygen. So when the person possesses an abnormal hemoglobin, it now distorts the shape of the red cell and gives you the sickle shape that we find in people who have this disorder. Now, how does a person get this problem, this disorder? It is inherited, so it means the person gets it from the parents. So both parents have to donate the S gene each, one from the mom, one from the dad, and then the person has what we call the sickle cell anemia.
What's so bad about the sickle-shaped blood?
Now, because it is an abnormal form of red cell, so first of all, the hemoglobin that is present in that red cell does not have the affinity to get enough oxygen that the body needs to function, unlike the A hemoglobin, which is the normal one, which carries oxygen all around the body in the regular and normal amounts that the person requires. But with the sickle shape, the oxygen concentration is not enough, and because the red cells are abnormal, they die faster. The normal red cell in a person who doesn't have the sickle cell disorder has a half-life of about 90 to 120 days. But in a sickle cell disorder patient, it lasts between 10 to 20 days.
But a human being does make blood.
Yes. But in a sickle cell patient, they don't make enough red cells, which is what now leads to the crisis and complications and symptoms that we see in them.
Okay, what are some of these symptoms?
Yeah. So from early childhood, when a person is born with this disorder, during the first months of life, sometimes it is not noticeable because you have what we call hemoglobin F, which is the fetal hemoglobin, still circulating in the young child, and that has a very high affinity for oxygen and can, mask some of these symptoms. But as the child gets older, he now starts having pains in the area of the body that produces the blood cells. So we have what we call hand and foot syndrome in early childhood. We have pains in the hands, pains in the foot.
Okay, like something like what we're seeing now.
Yes, exactly, like what we're seeing there.
But why are they swollen? Why are those hands and feet swollen?
Because the bone marrow in those long bones, in those areas, are the ones responsible for production of red cells. Now they are now into hyperdrive. Okay. So by the time they are producing more cells, the cells are sickled. There is blockage of the small vessels supplying those areas of the body. So you have what we call the inflammation, the pain.
Okay, you mentioned blockage. Sorry to cut you there.
Yes.
You mentioned blockage. These sickle-shaped cells, they block the vessels, is that what you're saying?
Yes, they coalesce together sometimes and block some of the vessels such that organs or parts of the body proximal to that part are starved of oxygen and other nutrients required.
Is that why they have pain?
Yes, that is why they have pain.
So anytime one sees somebody with the disorder complaining of pain, that's where our mind should go to?
That's one of the things our mind should go to, but there are other causes of pain in a sickle cell patient.
Do tell.
Yeah. In a sickle cell patient, you have different complications. We have different types of crisis. We just mentioned the vaso-occlusive crisis, which is where we have the blockage. We also have where the person's red blood cell is breaking down very fast. They are hemolyzing. So maybe the person is exposed to an infection. Commonest in this environment is malaria. So when they are exposed to malaria and they start breaking down red blood cells rapidly, and
we are seeing something like
yes, these are normal red cells. Yes, these are normal red cells.
And what's happening here?
They are passing through that's the blood vessel,
Okay.
So they are passing through the blood vessel.
Smaller blood vessels.
Yes. Yes, and now these are normal red cells.
This
yes.
is purple.
Now this is a sickled shaped red blood cell.
Why is it purple?
I'm sure. Well, when it's red, I'm assuming yes, exactly.
Okay.
So the purple means that it doesn't have enough oxygen because the hemoglobin in it doesn't have a high affinity for oxygen. Now that has they now coalesce together. You see that?
Okay.
Yes.
They are gummed.
Yes.
And blocked. Okay,
yes.
so those smaller vessels, those branches aren't getting any blood.
Yes. So
parts of the body. Is that the site of pain?
That site and site proximal to that, distal to that.
Okay.
They won't receive enough blood.
Those vessels that are not getting blood, the organs or they supply blood to, won't they die?
Sometimes, if something is not done quickly, which is the reason why when a patient has crisis, the first thing you should do is to make sure they get to a hospital. So by the time they get to a hospital, they are properly rehydrated, and once they are rehydrated, it allows this to move properly and clears this off at the point of stasis.
Okay, so rehydration is a very
important part of management in sickle cell disease.
Can't the person suffering from the disorder do that himself, herself, instead of waiting for this to happen?
In every sickle cell clinic, the first thing we tell them is the easiest and most inexpensive way of making sure you don't have crisis. Drink a lot of fluids.
So you can avoid a crisis with a lot of fluid. It doesn't have to happen.
To a large extent.
Describe a crisis, please, for me. Somebody is going through a crisis. What does one expect to see?
First things first, you see pain. That's the commonest presentation of a crisis. Pain, depending on the part of